Honorable Wangwe. We have Regional Commissioner, County Commissioner, and officials, county officials from both, government officials from both the county government and the national government, and members of the Fourth Estate. Good afternoon. I want to take this opportunity on behalf of the people of Kakamega to welcome you, CS Health, here, and to thank you very much for sparing time to come to be with us today. This is a day that we have been waiting for, and it's good that it is happening today. I will give you a brief history about Kakamega very fast. Kakamega County has 330 health facilities with nearly a population of 2 million people. And out of that 330, 190 are public health facilities. As a county, we have averaged our budget allocation of about 30% to health sector. And this financial year, we have slightly increased it to 31%. The health department is the biggest. It has slightly over 3,000 staff establishments. Obviously, as a county, COVID-19 has had a negative impact on access to health delivery. In this respect, we have established that citizens are afraid to come to health facilities. And I want to take this opportunity to urge the those who are suffering from other health diseases, please to come to the health facilities, because we have taken precautions as a county, and you have seen how we have made sure that we have proper isolation hospitals or facilities in Lukuyani and in Mumias and where we are. The three are the three facilities that you have cassetted to take care of COVID patients, while other facilities, our citizens are free to go there to enjoy treatment of other diseases. And we have the entire general hospital, the other side, the level 5, which you can access without mixing with the COVID patients. And because we are not a COVID testing center, and CS, I think this is an issue that I have engaged you, that we need as a region, we have all to go to Kisumu. So our testing capacity is very low. We have managed to test 629 samples, out of which 596 tested negative and 33 have tested positive. From those who tested positive, 2 have succumbed to the virus upon arrival at the hospital. And 1, in fact, died immediately before he was admitted and was tested posthumously. The number treated and discharged so far are 28. So at the moment, we are only having two of them at the facility, and about another 3 are in their homes under the home care program. And those who have tested positive range from 1 year to 88 years. As I have mentioned, Kakamega County has no approved testing lab. The county is using Kemri lab for COVID testings. And I have submitted 2 requests to your office to consider making Kakamega a testing center. We have 6 gene expert machines for testing, which can be calibrated to test COVID-19. But the problem we have is obviously the reagents. We are unable to access the reagent because that is the responsibility of the national government. We have selected special staff. We have special staff who are dealing with these isolation centers. They have been properly trained and they were selected on a voluntary basis. I'm happy to report that none of our staff has tested positive. For referral purposes, we have 3 designated ambulances for COVID, suspected COVID infected people. The 3 ambulances are used for tracing, and when people are discovered, those are the ambulances that we use. We have also about 4,000 community health volunteers, and all these 4,000 volunteers have also been trained in partnership with the Kenya Red Cross. Red Cross is quite active here. Public sensitization conducted by public health officers in the county by the following groups and stakeholders have been involved: the Kenya Medical Training Center, the Kakamega Police Forces, the business community, the hawkers, all have been sensitized on the issue of wearing masks and etc. and social distances. Roadblocks have also been stationed in collaboration with the national government in all entry points for screening at the time of lockdown, and a total of over 1.5 million people have been screened. On communication, the County Department of Communication has continuously sensitized the community on COVID-19 through the local and the national media stations. The county government on its own has allocated 105 million for the fight against COVID-19, of which a number of items have already been procured and some are in the process. The national government dispersed to the county 262 million that was timely appropriated by the county assembly. And we are in the process of spending this particular money, but because it came late and because of the IFMI system, we have not spent the 262. We are still using the 105 that we allocated ourselves. The county also have launched a toll-free COVID-19 response line, number 0800-720-573, for the citizen to aid the referral of mothers and citizens to reach hospital and other facilities. The county has also innovated a way of using the local administration in collaboration with the community health volunteers to map out all pregnant mothers in the community to aid in the access of health facilities through border. We are grateful to the staff that we were allocated, and through that allocation, between July and December 2019, we were able to recruit 171 nurses, 26 doctors, and 13 clinical officers. I want to give my deepest gratitude to the Rapid Response Team, which I chair and co-chaired by the County Commissioner, and the sub-counties for dedicating their time in ensuring that we have systems in place to promote prevention as well as the management of patients that have tested positive for COVID-19. I would like to single out the staff in Mumias Hospital, which is our first isolation center, for the dedication they have shown in serving the initial positive cases that we have in Kakamega County. Lastly, but not least, all the health workers, I want to thank them for their timely effort and endless dedication in serving the citizens of Kakamega and beyond. I urge them to continue in the same spirit. CS, as you have seen, we are completing our first phase of this referral hospital. This is a peak facility that the county government has so far spent 2.6 billion Kenya shillings. We will be coming to you for the support of equipping this facility, and we are hopeful that in the next 2 months, we will be ready to have this hospital used by the public. Otherwise, thank you very much. Now, I would want to give this chance to CS Wamalwa if he has something to say. As you know, Wamalwa is our brother here. I'm happy that he has also spared time to be with us this particular day. Thank you. Welcome.
Asante sana Governor Oparanya, Waziri Kagwe na timu yako kutoka Ministry of Health, viongozi wote wa county hii ya Kakamega na vile vile viongozi kutoka serikali kuu. Yangu ni kuungana na ndugu yangu Oparanya kukukaribisha Waziri Kagwe hapa nyumbani, na tunafuraha sana sababu tumekuona Kisii jana na leo umefika hapa kututembelea. Yetu ni kusema asante na pia kusema hongera, kuheshimu ugatuzi, sababu wengi hapa Western wamekuwa na kuona kwenye runinga ukitangaza kule Nairobi. Leo tumekuona hapa live na wengi sana walikuwa nataka wakuone hapa. Na sio hapa tu tumekuona kando na Kisii, tumekuona kule Pwani, tumekuona Mlima Kenya, na leo nikukaribisha hapa. And we want to say thank you for devolving yourself and your team to come to the counties so that you speak to the people directly, na pia wewe mwenyewe ujione ile hatua tumepiga sababu ya ugatuzi. Na kama kuna pahala Kenya hii ambako ungeenda utembee na uone kama ugatuzi unafanya kazi, ni hapa Kakamega County. Mwenyewe umejionea. Tunasema hongera Governor Oparanya, sababu what is behind us here is really a pillar of pride for us in the devolution family. Tukija hapa tunaona what devolution can achieve. Na tunajua kando na hii hospitali ni ile tu ya Nyanza, ile ilikuwa inaitwa Russia, ile ya Moi Referral na kule Nairobi ndio iko standard hii. So we are very happy to be here, na pia kusema hongera kwa Governor Oparanya na serikali ya county hii ya Kakamega. Mmepiga hatua. Waziri, kuna wakati Covid ilikuwa inaanza, kulikuwa na story ya kwamba kuna hospitali ambayo mgonjwa aliingia na akasema ako na corona na watu wote walikimbia mbio. Ilikuwa hapa Kakamega. We were totally unprepared wakati mambo haya yalifanyika, madaktari, manasi, hata askari wakakimbia. Lakini tangu wakati huo tumeona steady progress, na leo tukifika hapa Kakamega we are happy and we congratulate you, our brother Governor Oparanya, sababu Kakamega is one of the counties ambazo zimetimiza ile directive Mheshimiwa Rais alitoa to raise a threshold of 300 beds. Kakamega is above the 300 bed threshold, and we want to say thank you to Governor Oparanya. Thank you to the very able team ya the county leadership ya Kakamega hapa, na vile vile tuombe zile counties ambazo hawajafikisha the threshold. We know there are still about 14 counties. Ya kwamba let them borrow a leaf from Kakamega. Wakaze kamba kabisa so that we are able to achieve that threshold ambayo Mheshimiwa Rais alikuwa ameweka ya vitanda 300 kwa kila county. Hilo ndio jambo muhimu sana. Leo tumetembea Mumias, tumeona the isolation center huko. Nyingine iko kule Lukuyani. We want to thank the county of Kakamega kwa kujipanga na tuseme we continue supporting you. Kutoka serikali kuu, we know that one of the greatest responsibilities, yale majukumu yaligatuliwa, ni huduma ya afya. Wakati huu ambao tunapambana na corona na yale tutatangaziwa na Waziri Kagwe hapa, yanaonyesha ugonjwa huu unaendelea kusambaa. Lakini pia inaonyesha ya kwamba jukumu hili la huduma za afya, after 10 years after getting the new constitution, this is going to be the biggest test for all our counties. For national government, we want to assure you of our support. Juzi tumekuwa na mkutano na Governor Oparanya akitetea counties zile pesa ambazo zilikuwa zimesalia bilioni 29. Governor, we are happy as we speak. The 29 billion has already been released to the counties, and I think we'll continue supporting you to ensure that we build the capacity of our counties to deal with this enemy. Leo ni siku ya Waziri Kagwe, sitaki niseme mengi. Yangu ilikuwa tu ni kuja hapa, nijiunge na Governor Oparanya kukukaribisha. Tunasema asante na Mungu awabariki.
Thank you very much, my friend. Governor of Kakamega County, His Excellency Wycliffe Oparanya, my good friend CS Wamalwa, the Deputy Governor, Philip Kutima, the county executives and leaders, members of the Fourth Estate, members of Parliament here present, members of the administration. I can see the regional commissioner here, as well as the county commissioner, members of the police units who are here, and indeed all of us kwa jumla. Hamjambo. Let me begin by expressing what a pleasure it is to be in Kakamega today. It has been several years, Governor, since I was last in the county, but I must confess that each time I come here, I find myself taken by the clean air, the developments, and most importantly, the warmth of the Kakamega people. Bwana Governor, allow me to acknowledge the very warm reception that you have accorded my team and I. Orio, Muno, Obwami. We really appreciate the hospitality. I'm not sure, Governor, and I want to say this because I'm in here, and Kenyans might not know this, that Kakamega is both literally and metaphorically the land of gold. Literally because, Governor, if I remember the last time I was here, we went to a gold mine. I have not seen much about the gold mines, and I don't know whether it's a secret that you are hiding. However, Kakamega is not just endowed in gold. It is also endowed with agricultural wealth, and the gold puts it on the map during the 1930s gold rush. But it is one of the most, and it is also one of the most populous counties after Nairobi, given its size, and the county with the largest rural population in Kenya. It is the people of the Western region, led by Kakamega, Goma, and so on, that make the lives of Kenyans a little sweeter when we drink the morning tea because of the enduring hard work of our sugarcane farmers. They are a national treasure, and I want to let them know that tunawashukuru nyote kwa ile kazi mnaendelea kufanya kutuletea sukari, kwa sababu bila sukari wengine wetu hatutaenda kazini. Kakamega County is culturally alive in events such as we all know, Kuminya. I will not translate that for other Kenyans. Let's just keep it here. Because it is one of the things, Governor, we are dealing with is the health sector. And we want to ensure that no circumcision ceremonies are held without the protocols that are required to save everybody, particularly our children. But I will not get into that. That is something we can deal with separately. And Kenyans all over pay attention to your culture, and attribute that also, an attribute that also attracts other international organizations and persons. And speaking of the global arena, Governor Oparanya, let me congratulate you on your recent recognition for your governance and the transformational impact it has had on the citizens of this county. By being named one of Africa's most reputable individuals in a recent global reputation poll, you have flown Kenya's flag high, and we say hongera. We are proud of that. These accolades have also been bestowed on you because of your development track that is comprehensive, which includes the health component. Today, I can tell Kenyans without any fear of contradiction that I have never been to a county that has got the kind of health structure that sits behind where I am addressing you today. This project, Governor Oparanya, is not just a county project. This indeed is both a national and a regional treasure once completed in the form and format that you have envisaged it to be. And I want to say, as CS Wamalwa said, that these are the fruits of devolution. It is very unlikely that managed from the center in the health management system, it is unlikely, honestly, that we would have had this hospital behind us. A huge hospital, when completed, with 750 beds, a massive area for a massive maternity, and all sorts of very developmental and forward-looking projects that you have. This is indeed impressive. And I can tell you, Governor, that long after you are gone, the people of this county and others in the region will remember you for this institution. And I think we owe him a hand of applause. Kakamega County has also successfully managed its cases of malaria, achieved about 80% coverage when it comes to immunization of children, and managed to establish 5 treatment centers that have been prepared to handle the COVID-19 pandemic. The county has hundreds of health workers, as you have rightfully pointed out. But above all, you have got the kind of vision that is going to manage this disease in this county. There is Kakamega County Teaching and Referral Hospital, which is not only impressive because of its stature, but more importantly, because it has been funded virtually exclusively by the county revenues. When you look at the project behind me, you think that there is a national government, it's a donor, or some other institution that has been able to put it up. This is all through county revenue. Hongera for good use of money. From the ministry's point of view, the hospital behind me should not only capture the imagination of other governors, especially those that have not yet met the basic provisions, but it's a key point in the Big Four agenda that President Kenyatta has indeed been talking to us about. And talking about President Kenyatta, I would like at this point, Governor, to bring his greetings to the people of Kakamega, and to say that even as we are coming, we also want to greet the greetings of the Right Honorable Raila Odinga, who also called us when we were in the governor's office to say to the people of Kakamega to send greetings to them. Fellow Kenyans, as we go around the country to assess the level of preparedness that each county has, we have not only been learning more and more about the virus itself, the varying ways it has manifested itself amongst our people, but also how much adherence we have to the measures that we keep preaching. A good example is when we give emphasis on the value of isolation and the fact that when one is diagnosed with COVID-19, all they need is to follow the rules, seek and receive support. And I'm glad here in Kakamega, you have organized the issue of contact tracing and isolation. Because of the level of infections that you have in the county, it is possible to completely isolate and protect the people of Kakamega if proper contact tracing and isolation are adhered to. But there is also the other flip side. I've just received news from one of our counties about a situation that perfectly illustrates what we have been talking about. A son who was tested and confirmed as positive for coronavirus refused to accept the diagnosis because, according to him, the virus is a myth and it does not exist. Based on this, he refused to self-isolate, which led to the infection of his sister and parents. Unlike him, they are old, they are elderly, and as is the usual case, had underlying conditions, so they were impacted more. As we speak, this family, whose first positive case is still alive, has lost an elderly family member, the head of the household, just 2 weeks after it lost and buried his mother. You can only imagine the sorrow that is engulfing them, and as it should, the guilt that forever haunts this young man. Governor, you know, sometimes we get the bad end of insults in this ministry. We have been accused of talking to Kenyans as if they are retarded. We have been accused of all sorts of things. Tumetukanwa kwa sababu ya kusema vile tunasema. Because of explaining what we are explaining. Because of telling Kenyans the impact of what happens when we don't follow advice. What happens vile kunafanyika tusipofuata masharti yale ambao tumeweka kwa serikali, yale ambao watu tunaomba, tunasihi wananchi wafuate. Kwa hivyo sasa hadithi kama hii inaeleza na ukamilifu ile inaweza fanyika tusipofuata haya masharti na zile kanuni tumeweka, ndio watu wasiumie. My brothers and sisters, I can only implore you to accept that COVID-19 is a reality. But when handled properly, through all the measures you are only too familiar with at this point, it is a condition that we can control. Kenyans don't have to die. We can do this thing. We can manage ourselves, we can save lives, and we can save ourselves in the process. As I look in front of me, I notice with pride, I am so proud of Kenyans, because when I look in front of me today, I cannot see a single person without a mask covering both their mouth and their noses. This is development. This is progress. In terms of the fight against COVID-19, this is progress. And I want to thank you. I want to thank you all. Because when you save yourself, chances are you'll also save somebody else. You'll save a son, you'll save a mother, you'll save a sister, you'll save a friend. And for that, we are grateful. I wish everybody would start doing exactly what is happening here in Kakamega, and that might explain why the levels that are, the low levels that you have here, you know it kills, we can save ourselves. And it is not necessary for us to be insulted because of telling people again and again and again. But we will not stop, and I will not stop, and the ministry will not stop, and I'm sure the county governments will not stop. Because it is better to be here, it is better to be bored with the figures than to be bored for 3 weeks staring at the ceiling of a hospital bed, lying backwards because you are sick. No, 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 no. We will continue to tell you and implore you, and we hope in the process, you too, who are hearing what we are saying, will also become part of us in telling Kenyans what needs to be done. As a national government, we will continue to work with your government, Governor Oparanya, and indeed the rest of the counties, to deliver the much-needed support of PPEs and masks to our health workers to enable a stable health sector. We are proud of the fact that Kakamega County has only the few numbers that you have said, and I pray to God that this continues to be the case. Na mimi najua, Bwana Governor, tukiendelea vile mimi nimeona hapa Kakamega, kujitayarisha vile kaunti yako imejitayarisha, kufanya vile nyinyi mmefanya kutayarisha mahospitali, isolation centers. Tumekuwa huko Mumias, tumejionea sisi wenyewe ile kazi inafanywa huko. Wajua kuna wakati nyingine vile vile tunaambiwa na usiasa. Siasa ikiingizwa katika mambo ya usawa, mambo ya afya ni mbaya sana, kwa sababu inaharibu mambo mengi. Lakini vile vile kuna wakati tunaambiwa ati wewe mnadanganywa, hizo isolation beds mnaambiwa hakuna, ni sinema tu. Lakini hapa sisi tumekuja, tumejionea, tumehesabu, tunajua ni ukweli vile Governor Oparanya anasema. Na kama mtu hata akiwa hana macho, aangalie hapa nyuma yangu aone ile mjengo iko hapa ya hospitali, mimi naamini Oparanya hiyo atajionea. Hata mtu ambaye hana macho anaweza ona hii. This is a massive project and I'm so proud of you. Turning to our COVID-19 situation statistics today, we have recorded some 699 new cases, rising out of a total test of some 7,175 people, cumulatively now arriving at 25,837 persons. We have now got in this country tests that we have carried of nearly 350,000. And from the new cases, 675 are Kenyans, while 24 of them are foreigners. In terms of gender, 427 are male and 272 are female, from a 1-year-old baby all the way to 85 years old. But on a more positive note, today also is a happy one, because we have released some patients. 781 patients have recovered from the disease. And this brings our total of recovered patients to 11,899 so far. 125 from various facilities, while 656 from home-based care programs. And I want to emphasize that because you remember when we were at Mumias, your technical people were telling us about how much they have done, the investment they have done, the teaching, the observations with the healthcare workers to see that the home-based program works. And we are very proud of Kenyans because of the success that we have experienced with the home-based care program. And Dr. Amoth is here, can confirm that so far we have not lost a single person on the home-based care program. And that tells you that the facilities at home and the atmosphere at home may work better for people rather than in hospitals. And the healthcare workers are not just working in hospitals, they are also working in homes. And when we continue every day to thank you, healthcare workers, for the fantastic work that you have continued to do. Sadly, we have also lost some 5 patients today who have succumbed to the virus, and therefore, as we speak, we have got 418 Kenyans who have perished. And this number is a sad one because we are talking about somebody's mother, you're talking about somebody's son, somebody's brother. It's not just a figure, it's people. And it is sad that we have lost those many people. So hopefully, this is something that we can contain and see that the fatality rate does not increase. Bwana Governor, nikimaliza na kama ilivyo desturi ya Kiafrika, nimetembelea wewe hapa, nilikuwa nataka kukuletea mbuzi, lakini kwa wakati huu nikaambiwa watu wa Kakamega hawataki mbuzi, wanataka PPE. Kwa hivyo I was told no goods, no food, no whatever, just bring some PPEs, and I know you have been very insistent on that support. And for that reason, I would like to proudly say that we have come with us with some 4,000 PPEs and also 4,000 masks aimed at the healthcare workers. I thank you, and now prepared to take one or two questions. But before I do so, let me also react to two things that you asked. One of them is the issue of the testing, Kakamega to be made a testing facility. As you yourself have pointed out, there are machines here, testing machines. We have got the gene expert machines. And one of the problems that we have experienced as a country is with the gene expert machines. As you know, these machines are American-made machines, and we have been trying desperately over the last 5 months or so because of the fact that they are used for testing other things, malaria and so on. And we have been trying to get them to get the reagents for testing. It's been very difficult because of the situation, as you are aware, in the United States, where they also have their own very grave issues. They have also been supplying those to, because it's not strictly speaking, they have been supplying, strictly speaking, it can be used for other diseases as well. So they have been emphasizing more on the other diseases on the gene expert machines other than COVID-19. However, moving forward, and this is something we are discussing at the Health Ministry, in future, we will try very, very hard not to buy machines that are closed systems, that you can only get the reagents from a specific supplier. We have had challenges, particularly the American-made systems. We have had challenges with the Roche machines because of Roche reagents. We have got challenges with the gene expert machines because of the reagents thereof. And as a ministry, we will look more moving forward at open systems rather than closed systems. We also, we would like to mention that the discussions along which we are having in the ministry and the lessons that we have learned in terms of testing capacity, in terms of the reagent sourcing, is that it would actually be better for us to have put machines. The technology is changing very, 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 very fast, and it would be better to have machines installed by other people, and we simply buy reagents to run those machines, and when the technology overtakes the machines, they come and take their machines and put them back again. These are some of the challenges that we are experiencing. These are the discussions we are having with the experts at the ministry to see what method works best for us. So, Governor, we will be trying as much as possible to acquire the reagents, and when we do, we can guarantee you that this will be one of the testing centers. I'm also glad, Governor, to say that as we came, we also came with our people here so that they can see what you have, so that we can also establish in our ministry what we need to do. We are very impressed with the way your nurses are assisting. We have seen them, we addressed them with you. And in fact, even with us from the ministry today, we also came with Professor Eunice Durango, who is the chairperson of the Nursing Council of Kenya. Where is Eunice? Oh, you are here. Karibu sana. And also Edna Talam, who is the CEO. Edna. So nurses, you are well represented. Have no fear. They are all here, and they are here to see what, how it is here and what we can do to assist you even further. Yesterday I did say we are also accompanied by Dr. Wafa Osman. Wafa, where are you? Dr. Osman is also here with us. He heads the directorate that deals with all these issues that we are talking about here today, as well as Susan Koki Mutua. Is Susan around? Susan Mutua, who is head of public health department in the Ministry of Health. Of course, leading them. Also, Rose, I don't know whether Rose Modibo is here. Rose Modibo is a director in my office for liaison, and she's from Kakamega. And she is no. Are you from Kakamega or Busia? Matungu. Okay, whatever. From Kakamega, Matungu. Okay, I didn't know that one. But of course, heading them all is Dr. Patrick Amoth, who is the acting DG in the ministry. So at this point, Governor, if you allow me, let me give opportunity to members of the Fourth Estate to raise whatever questions you might have. Please indicate the House, and the question is addressed who. And I am talking about members of the press, because we have had a few adventurous people also raise their own questions.
So, My name is John Shilisa from the Standard Media. My question is to the CS. Bwana CS, I want to know why COVID testing has not been devolved to counties and made available and affordable to those who may need to be tested. And then number two, I also want to know what your ministry is doing in supporting faith-based and private facilities within counties like here in Kakamega to prepare to handle these COVID-19 patients. And then lastly, I want to know how much counties have so far received from the emergency response kitty and the measures put in place to ensure prudent utilization of these funds. Thank you so much.
Good afternoon all. Waziri, nitaomba nizungumze kwa lugha ya Kiswahili. Kwa jina naitwa James Boaz, natoka Lubao Radio, one of the local media house in Kakamega County, in Western. Swali la kwanza ni kwamba wengi wa Kenya, hasa wale ambao wanaishi mashinani, wangali na swali, hizo idadi ambazo mnapima zinapimwa wapi? Labda utaweka wazi mali ambapo zinapimwa na hasa wanazingatia mbinu ipi kupata wale watu ambao wanapimwa. Manake tumeona wengi wakiogopa kwenda zahanati ama hospitalini kupimwa. Swali la pili, tumeona serikali imezindua mradi wa kazi mitaani. Na tumeona vijana wengi wakijitokeza kufanya ile kazi, ila kulingana na Wizara ya Afya ama wale wataalamu wa masuala ya afya ni kwamba service ni miongoni mwa vitu ambazo zinachangia infection ya COVID-19 kama labda virus zinapatikana chini. But most of people tumeona wakifanya ile kazi without gloves. They are just going. So labda serikali kando na kuwapatia ile kazi pia inaweza wasaidia to have those facilities so that they can do their work. Then number three, most of people, like today we are talking of Western, most of people, they are asking themselves, they had a conflicts na police. Now, quite a number of people we have interacted with in villages, they are telling us that like expectant mothers, they don't want to go in hospitals. Labda, you can help them or you can tell them which means they'll use for them to acquire for those services. Thank you.
So, yeah. The last one.
Yeah, Waziri, my name is Kefa Juma from Royal Media Services, Kakamega County. I have just one question because the other questions have been actually raised by my colleagues. I'm on frontliners who are not employed by the national government or the county governments and are working in isolation centers. How are they going to get these allowances, risk allowances, because they have a willing heart to actually to do their work? How are they going to get risk allowances? Thank you.
Okay, thank you. Yes, last one then.
Jina langu ni Mulindi Keri kutoka runinga ya TV47 na maswali mawili. Kwanza, inahusiana na lile ambalo umegusia tu kwa kiduchu kuhusu utamaduni wa upasaji tohara. Jamii ya Bukusu imeendelea kuendelea na shughuli hiyo. Je, msimamo wa serikali na Wizara ya Afya ni ipi? Swali la pili inahusiana na home based care. Maambukizi ambayo tunaona kwa sasa, je, yanahusiana na home based care? Asante.
Okay, thank you very much, Asanteni. Let me try and very quickly run through the issues then. A lot of them are things that we have spoken about before, but one or two are things that we should respond to. The first one, Shilosa, is about the issue of testing. As you know, the issue of availability and affordability and why we are not expanding our testing facilities. As a matter of fact, we are expanding our testing facilities. At the start of this campaign, 5 months ago, we did not have a single testing facility in this country. Within very few weeks, we developed a testing facility at Kemri in Nairobi. And today, I can tell you, we have about, is it 28? 32. In fact, I'm even being left behind by Amoth. He has developed 32 testing centers across the country. So a lot of these ones are where we have got the machines that are applicable to the reagents that we are able to get. And the only reason why we are not testing in every county is just because of the combination, the systems that we have, and the fact that the reagents for those systems, as an example being Kakamega, are not easily available. But as soon as they are, we would like to have not just one per county, but in as many hospitals that have got labs as possible. So from 0, we are at 32 and still continuing. So we'll be making progress as we go along. On the issue of faith-based facilities and our understanding, as you are aware, we started off, we have got the Interfaith Council, which we launched in Nairobi a while back. CS Matiang'i and I are members of it, or observers of it, and they are headed by Bishop Muheria and others in the team. And essentially what has happened is that between the Interfaith Council and the Ministry of Health, we have developed protocols that we all own and which we operate on. And the view we have taken at the Ministry of Health and in fact in the government is that faith-based organizations, having developed for themselves the protocols that they have, are best suited to be able to administrate those protocols. And so far, I can tell you that most of them have adhered to them in a very admirable manner, in a very disciplined manner, and we hope that this is what is going to continue. Not even that, the faith-based organizations have also been in the forefront of in the fight, in the behavioral change fight, with a big measure of success. Because as you know, and I want to quote Bishop Muheria, Muheria says the faith-based organizations appeal to the heart, while perhaps we appeal to the mind. And that combination may work very well for all Kenyans. So the protocols to use within the churches and other religious institutions are the protocols that have been developed by the Interfaith Council. In terms of money, as you are aware, through the effort of the governor here, the counties were given some 3.5 billion. Is it 3.5? 5 billion. 5 billion shillings. President Uhuru Kenyatta ordered that 5 billion shillings be given to the counties. The 3.5 billion was the healthcare workers package. So the 5 billion that the counties were given is a conditional grant. Now, conditional grants, and this is in response to the issue of how the money is going to be used. The conditional grant is specific in its nature. In other words, if you are given a conditional grant of some 200 million shillings for use in COVID, you cannot use that money for other purposes except COVID-19 issues. So far, we have not noticed otherwise, and we hope that the money will be used in the manner in which it was given. James, on the issue of where to take the test, generally speaking, and this is something I'm going to ask even my colleague, Dr. Amoth, to talk to, on the matter of who needs to be tested. I think that I'll leave that to Amoth to explain, that where there is huge community spread, this is the method of testing, where, for example, you have got Kakamega, the way it is today, where contact tracing is the key to managing the disease and who needs to be tested. Because it is not each and every person in the country who has to take a test so that we know how the spread has been. But I have said openly that don't wait to be told whether the person next to you has got the virus or not. Assume that they do. Assume that they do. Then you are okay. You know, when you see somebody whispering at another one, then you know that this person whispering at you without a mask is danger. With a mask, you are good to go. So social distancing, irrespective of whether you know they are positive or not. Kazi mitaani, it is surprising what you have said, James, is a bit surprising, because one of the things that we said at the start of Kazi mitaani is that each person working anywhere, being paid by any government in any place or any private sector must have a mask. And therefore, if you have seen people working in the streets, and the ones I have seen working even within these hospitals, have all got masks. So if you have seen somebody working in the streets without a mask, then definitely it is not a government issue. It is that person's issue. Because what did you say they have gone there to do? You said they have gone to work. If they have gone to work, surely they can buy a mask, or make one. If you have gone to work, why are you waiting to be given a mask? Umeenda kazini, una pesa, kwa sababu kwani unalipwa na nini? Si unalipwa pesa? Wale watu ambao wanahitaji kupatiwa mask ni wale watu ambao hawana kazi. Hana kazi, kwa hivyo hawezi kujinunulia mask. Lakini ukiwa una homa na unaenda kazi, si unaenda unanunua handkerchief? Ukienda kazi, unauliza serikali ipatie mtu handkerchief? Hapana, mtu ananunua yake. Kwa hivyo hata mask vile vile. Wewe nunua mask au ukiwa na pesa, umepatiwa kazi mitaani, unalipwa kiasi kizuri. Kwa hivyo wewe nunua mask. Hapana ngoja serikali kupatia mask. Lakini those who don't have any money, those who can't afford them, definitely we are going to support them. And indeed we are distributing those masks. Lakini ukiwa una pesa, sio kusema ati this is where they come and tell us that we are not talking nicely. The intention is not to talk nicely. The intention is to tell you to buy a mask. Anyway, now this matter, Mlingi, this matter circumcision is a matter that we are working. We must work closely with the county governments, the elders of the communities, those people who are head of circumcision units. These are the people we must work with, so that we tell them, yes, ikiwezekana, inaendelea, lakini this is, don't kill anybody, these are the protocols, na mambo kama hayo. Lakini hakuna haja ya kuzungumza hiyo yote hapa, kwa sababu viongozi wako hapa, the leaders of the counties, and I think that we should engage with the Ministry of Health at any point that we are going ahead. Let's always make sure it is with the guidance of the Ministry of Health. Kefa, on the issue of, I think you talked on the issue of isolation centers and frontline workers, particularly those who are not within the scope of the payment structure in the ministry. As you know, we have a lot of community health workers and even volunteers who are working with us at the moment. And the care that we take, first of all, is to appreciate what they are doing. Over and above everything else, to appreciate what they are doing. But we also intend to continue improving the care and at individual level that we give them in accordance with what we are able and what we can afford. So as we go on, we have continued to improve the situation at the county government level. The national government has supported with these packages of healthcare workers. And as the situation improves, we will continue, because we feel it and we know what they are doing. And it will be very bad if they are just volunteering themselves, working as hard as we are, and we don't remember them. I think you would be very unreasonable people. So as the situation improves, we will continue to also work with them. So I would like to invite Dr. Amoth to talk about the tests and also perhaps mention a little bit about the home-based care. Dr. Amoth.
Thank you, Waziri, Excellency Governor C.S. Wamalwa. I'll start with home-based care and categorically state that there are no infections that we have witnessed from cases that are under home-based care. In fact, it is the reverse, that we have not recorded a death from more than 7,600 cases that have gone through the home-based care platform. And we'll continue to espouse the home-based care platform because it is 9 times cheaper patients recover at home, an environment that they are very familiar with. And going forward, you'll be able to see more and more cases in terms of discharges coming from home-based care rather than the institutional facility discharges. This is more so because 93% of our cases are asymptomatic. So it just makes business sense to be able to manage them from home so that we leave the institutions to be able to take care of those with severe or moderate disease. And in terms of testing, testing is key in management of SARS-CoV-2 disease because it is only through testing that we'll be able to tell whether somebody is positive or negative. As Waziri continuously tells us, if you look at your neighbor, he or she could be harboring coronavirus, but you'll not be able to know until you do the testing. Africa as a continent has had challenges with testing because of global supply constraints, because these things are manufactured in the West and the Far East. But we have done well. Remember our first few tests that we did in South Africa and the National Institute of Communicable Disease. It took us about 5 to 7 days to be able to get the results. One day we promised Kenyans that we'll have the results in 48 hours, yet the sample was still held up in Burundi 3 days later. So we have come a long way. We should also blow our own trumpet. But our intention, of course, is to decentralize testing to as many facilities and all the counties as possible. As of today, our per capita testing is 6 per 1,000 population, 71 per 10,000 population, and 705 per 100,000 population. In terms of testing, Kenya is ranked among the top 10 or 12 countries in Africa. Of course, South Africa leads because they had this testing capacity even before COVID came into being. How we test is, one, you meet the case definition criteria for coronavirus disease, and we continue to change the case definition criteria as more information becomes available. For now, if you have a cough, fever, difficulty in breathing, loss of sense of taste or smell, that qualifies you as a potential positive case, and therefore we submit you for a COVID-19 test. Number 2 is contacts of confirmed cases or suspected cases. If you are confirmed or suspected, you are a suspected case, then we get your contacts and also submit them for testing. Number 3 is, of course, the high-risk group, the frontline healthcare workers who will be able to see all sorts of patients, COVID and non-COVID, and therefore will be at a very high risk of contracting the disease. So we prioritize their testing. Same as those who work in places like prisons because of congestion, the security officers, people in the transport sector, hotel workers because of that risk of exposure. We have further changed our testing strategy to be able to give us more dividend in terms of the investments we made. And going forward, we'll strictly only test those who meet what is contained in the strategy. But I can assure you that Waziri and the team and the ministry are working very hard to ensure that testing is brought as close as possible to the people. When that is not possible, we have a sample referral system that ensures that even though Kakamega is not able to test, they can quickly send their specimens to Kemri Kisumu for testing. I thank you.
Thank you very much, Dr. Amoth. Before I finally excuse ourselves, I would like to once again reiterate our thanks to the county government of Kakamega, and I want to also thank you, Governor, for the cooperation that you have had between yourself and the county commissioner, because as you know, in COVID-19 management, I wear the hat of the chair of the National Emergency Response Committee on Coronavirus, and at the county level it is chaired by the governor and the county commissioner. And I want to congratulate the county commissioner as well as the regional commissioner. Asante sana, thank you very much. And the cooperation that you have shown between the county administration and the county government is essentially what has made Kakamega so successful. Thank you, Governor. I also want to thank the members of the police force because of the vigilance with which they have been working at. An incident here and there should never waver, should never mean that our police are not in the front line as well in the fight in this disease, and I want to thank them. Thank you very much, and good afternoon.
Thank you. But there was one question that maybe you never answered. The COVID-19 fund, money that has gone to counties.
I did. The
Oh,
5
you did?
billion.
Okay.
Yes, I did.